Assalamualaikum and good evening, everyone. For today, week 6 IPE, we will be doing the presentation and discussion about the articles. So we have choose the articles, which is the case on medical negligence on the rise, Health Ministry data show. So this is articles. So the articles is the ineffective communication, lack of teamwork, heavy workload, staff fatigue, failure to follow procedures, and use of shortcuts. So the task that we have been given, we need to do the how to overcome the problem, the medical negligence. So the first point is, as a team of healthcare professionals, we should invest in effective risk reduction strategies, as well as enhancing the healthcare environment, providing safer equipment, staffing levels, and most importantly, developing our safety culture. So that's from
For second point is maintaining appropriate staffing in healthcare facilities is important to provide a safe work environment for healthcare professionals and safe patient care. Implementing policy that promote wise hiring, effective use of employee, provide ongoing staff training, and improve effective communication and teamwork skill can improve operation efficiency and avoid unwanted events from happening. I'm Lim, thank you.
So the third point will be, the staff can report any fatigue-related event to a manager to help prevent injuries and errors. Management also can develop processes to relieve a worker from their duties if they are too fatigued to work safely. One of the things they can do is having extra or backup workers. That's all from me.
Okay, so for the fourth point is, successful healthcare professional teams must endeavor to comprehend the patient's position, ask probing questions about the problem, do an initial evaluation, and give a proposal after discussion. In addition, healthcare teams can collaborate to design health promotion strategies for various communities and implement disease preventative practices in patients. Thank you.
So the fifth point, healthcare professional teams should share their responsibility to avoid the unwanted events to happen. Many of the duties and tasks of hospital personnel overlap. The team approach lightens the load for many of the providers who then don't have to replicate the work of other team members. While doctors usually assume the final responsibility for patients' treatment plans, and a team approach allows other staff to take the lead when appropriate. A treatment plan may require final approval by the physician, but primary duties of organizing the duties and follow-up care can be run by another member of the team. That's all from me. Thank you.
Okay, so for the sixth point, healthcare professionals must set higher standards, such as following protocols and procedures to ensure that every session runs properly. Thus, this is where teamwork comes in. To ensure all goals are met, each and everyone in the team should work together to make sure everyone understands what needs to be done. When it comes to prescriptions, cancellations, complaints, security, and the preservation of all medical information, the team must set a high barrier with clear, strict policies. To ensure that their techniques are up to date, the team should keep up with new advances in their particular areas. Thank you.
So the seventh point is, healthcare professionals need to have passion for the job that they want to be a part of. It is important that they are passionate regarding the things that a successful healthcare professional will do. This is because at the end of the day, it is not just a job that needs to be done. It is a commitment to helping others that are depending on our professionality to help them. It can be demanding and challenging, but it can also be rewarding for us. This can be achieved when we really love what we are doing. It is about having the right attitude and getting up each day excited for what lies ahead, knowing we will be making a difference as a healthcare professional, no matter how big or small it is. Thank you.
Okay, for point 8, in a teamwork, healthcare professionals should understand the roles of each other's team and the value they provide. As a healthcare professionals, they hold the responsibility to the patients. Therefore, skills development also important in the quality of service. The communication between each other is also important, and develop respectful and trusting relationship with peers. It is also important to maximize service. Poor teamwork and bad communication often features in errors, complaints, and negligence claims. Good teamwork and effective communication decrease the risk of harm to patients, but also increase staff engagement. This spark a virtuous circle. If you work in a good team that communicates clearly and supports you to speak up, you will most likely be happier at work. Evidence shows that greater staff satisfaction leads to better quality care. So thank you.
Okay, for point number 9, the healthcare professionals should really understand the procedure for their works, and mostly in the teamwork, they need to know their roles and work based on the procedure, as the procedure was made for being the guidance for the healthcare professionals to avoid any mistake in the surgery process. Every healthcare professionals also need to keep reminding each other for the implementation of the procedure to avoid any important step being skipped. Other than that, the implement of shortcuts should be avoided by the healthcare professionals because it can lead to more serious injury because the high risk of the shortcuts. That's all for me. Thank you.
Hi, I'm Osari Shori, and point 10. As a doctor, you spend thousands of hours developing your profession and broadening your educational horizons. Having said that, expecting you to know how to treat every patient for every symptom by memorizing every prescription is simply ridiculous. You aren't going to have all the answers, and you cannot expect yourself to. As a doctor, you owe it to your patients to put your pride aside and seek extra consultation for matters that aren't within your scope of practice. If you're unsure about something, seek assistance. There are plenty of specialists out there that can help, and under no circumstance should your stubbornness be placed before the health of a patient. Thank you.
Okay, so hi, my name is Nurin Husna, and for point number 11, healthcare professionals should keep complete records and documents. The purpose of this documentation from a legal perspective is to accurately and completely record the care given to the patient, as well as their response to that care. And documentation has legal credibility when it is accurate, truthful, and appropriate. If the treating doctor does not document what happened between the patient, it will be difficult to prove that it had occurred. So charting accurately and thoroughly can help to understand what happened to the patient. And in addition, it will help in answering the questions raised about duty of care when called for a deposition months or years after the event has occurred, as the doctor in charge cannot solely rely on their memory for facts. Thank you.
So for the point number 12, teamwork is important in nursing because it generates effective and open communication among healthcare professionals, improving their ability to care for patients. As a nurse, play an important role in connecting patients, doctors, and administrative personnel. When treating patients, multiple nurses and other healthcare professionals can work together to ensure that they are provide a considered standard of care to each patient. This improves the patient experience, ensure accountability, and makes the treatment process more secure. Thank you.
Okay, for point number 13, the evolution of healthcare and the global need for high quality patient care necessitate concurrent professional development in the healthcare field with a strong emphasis on a patient-centered teamwork. Only by putting the patient at the center of treatment and embracing a broad set of values and beliefs can this be accomplished. This will aid in the formation and development of an effective team incapable of providing great patient care. That's all from me. Thank you.
Next point is from the article, it do mention about the case related on unwanted event that occur during the surgery. So I think the improvement shall be done is that the healthcare team need to have a little discussion or meeting at least twice or one day before the surgery and to double check all the procedures and rules of each individuals to avoid unwanted events such as absence of medical staff, lack in skilled emergency, and many more so that the surgery can run smoothly. I pass the point to the next presenter.
The last point is in delivery of healthcare, effective teamwork can immediately and positively affect patient safety and outcome. The need for effective teams are critical in purpose to increase comorbidities and complexity of specialization of care. This is the right time for health practitioners in any health organizations to take action in delivering a quality care that satisfies his or her patients. The evolution in healthcare and a global demand for quality patient care required a parallel healthcare professional development with a great focus on patient-centered teamwork approach. This can be success by placing the patient in the center of care and through sharing a wide-based culture of values and principles. Thank you.
So that's all from our group. Thank you very much.